My name is Shine Maknaja, and my presentation is on epidural and spinal anesthesia. This is spring semester 2017. My name is Shine Maknaja. My topic is regional anesthesia. My mentor is Christy. The mentorship site I go to is Clear Lake Regional Medical Center. My teacher is Miss Christy Click. My mentor's profession is that she's a certified registered nurse and anesthetist. And this is ISM Spring 2017. Disclaimer, some of information in this presentation comes from outside sources. What is independent study mentorship, ISM, and what the course requires? ISM is an advanced academic course designed for students wishing to mentor an adult professional in a chosen career. The course requirements are an in-depth study in an area, minimum of 3 mentorship hours per week, complete an ISM portfolio showcasing all the completed assignments throughout the semester, the final project, complete a midterm project, and create a product. Background and training information of my mentor. She got her Bachelor's of Science in Biology from University of New Orleans, which took 4 years. She did head and neck surgery, or head and neck cancer and lung immunology research for 5 years before changing her careers. Bachelor of Science in Nursing from University of Pittsburgh, which took a year. She worked in the neurological intensive care unit for 2.5 years in Phoenix, Arizona. And she got her Master's of Science in Nursing from Kaiser Permanente School of Anesthesia in California State University of Fullerton, which took 2 years. Brief information about the mentorship site. It's a $92 million patient tower. It's about 155,000 square feet, including operating rooms and intensive care and observation units. Clear Lake Regional Medical Center was opened in 1972. There are approximately 2,000 staff members and 900 physicians today. Key points: what is an epidural anesthetic? What is an spinal anesthetic? Risk factors and complications associated with epidural and spinal anesthesia. Possible nerve damages associated with epidural and spinal anesthesia. Weebly website, product, artifacts, and current event. Artifacts, this is a picture of my mentor. This is a brainstorming idea, you can't see. And these are laws, legal issues, anesthesia consent. Before they give any anesthesia, CRNAs and anesthesiologists have to go by the patient's room and ask them and tell them the type of anesthesia they're getting. Either it's general, epidural, or it's MAC, and the type of side effects or risk factors they are for anesthesia. And if they don't have any questions, they'll sign the consent, and during the surgery they'll get anesthesia. These are all the components in a combined spinal and epidural kit. And this is a pre-op anesthesia evaluation. It's anesthesiologists and CRNAs have to fill this out before the surgery to see if they have blood pressure, high blood pressure, if they're obese, how much do they weigh, and other things. This is a typical education and training for a CRNA. These are 2 diagrams. These are the layers that the spinal anesthesia injection passes through before getting to the spinal cord. And epidural and spinal anesthesia, it shows how far an epidural anesthesia would go or injection would go, and it shows how far a spinal anesthesia or injection would go. Artifacts, types, and categories. These are the different types of anesthesia. There's general anesthesia, epidural and spinal anesthesia, regional anesthesia, and MAC. Manual pamphlets and information handouts. This is a pamphlet on epidural anesthesia. It informs pregnant women the advantage of epidural anesthesia, how it works, the side effects, and what are the advantages of epidural anesthesia. My weekly website. This website has many pictures of the mentorship site, journal entries, activity logs, and many more assignments I had to complete this semester. The purpose of this website is to showcase my coursework that I have done throughout this semester. After the presentation, I'll be going back to the website. What is an epidural anesthesia? Epidural anesthesia involves a hollow needle and a small flexible catheter which is inserted into the epidural space in the back or lower back. The area is, before any needle is injected, the area is cleaned with prep solution, and then it's injected with, then it's numbed with local anesthetics. The needle is inserted and removed after the catheter has passed through, and it's in the epidural space. Epidurals can be placed anywhere in the back. The catheter remains in place and is secure on their back, so if more medicine is needed for pain relief, CRNAs and anesthesiologists can give it easily. This is a video on an anesthesiologist or a nurse anesthetist performing an epidural anesthesia.
It's not loading.
It's not loading.
Okay. Maybe in the when you send the link out, you can just send a link when we send the presentation out.
Okay. What is spinal anesthesia? The anesthetic medicine is injected using a smaller needle into the CSF that surrounds the spinal cord. Again, the back is prepped with prep solution and then numbed with local anesthetics. The needle is guided into the spinal canal where the anesthetic is injected. This is usually done without a catheter involvement. The amount of medicine determines how high the block will go. For example, a C-section. For a C-section, anesthesiologist or nurse anesthetist if they inject in the lower back, the mom will get numb from the nipple line down to her toes. The video is not playing. Risk factors of spinal and epidural anesthesia. Allergic reaction to the anesthesia that is used. Bleeding around the spinal cord. Spinal column is cut off right there. Difficult urinating. Drop in blood pressure. Infection in your spine. Nerve damage, and severe headache. Nerve damage is associated with anesthesia. Nerve damage is very rare in spinal and epidural injections. Nerve damage is usually temporary if it happens, and then permanent nerve damage is really rare, but if it happens, it results in paralysis. A single nerve or a group of nerve may be damaged, therefore a smaller area or a bigger area may be affected. Nerve damage associated with anesthesia continued. In its mildest form, you can get a small numb area on your body. In other cases, there may be areas of your body that may feel strange and painful. Weaknesses may occur in one or more muscles throughout the body. In action at Clear Lake Regional Medical Center, in the event if neuraxial anesthesia fails, anesthesiologist or nurse anesthetist would convert into a general anesthetic with an endotracheal tube or a laryngeal mask airway. The patient would then stay asleep, breathing anesthetic gas, so he wouldn't wake up or he wouldn't feel any pain. Current event, risk of epidural hematoma after neuraxial techniques in ITP parturient. The authors performed a retrospective group study identifying ITP patients, parturients who received a neuraxial technique and estimated the risk of epidural hematoma. The results were the number of ITP parturients in the literature who received neuraxial techniques without complication has been increased significantly. The risk of epidural hematoma associated with neuraxial technique in parturient at a platelet count less than 70,000 millimeter remains poorly. And ITP means that. My product. The supplies I used to create this product was the component inside the combined spinal and epidural tray, a sturdy foam poster board, Sharpies, ruler, pencils, and the information online. I created a poster explaining the different procedural components, prep fixation components, and drugs that are used when an anesthesiologist or a nurse anesthetist is performing an epidural or spinal anesthesia. So that's my rough sketch and that's my finished product. This is what I made. Spinal needle is inserted into the spinal canal, commonly to collect CSF for diagnostic testing. Tubing needle, it's used for placing catheter into the subarachnoid or epidural space. Glass lower lock syringe is a loss of resistance. It's designed for locating the epidural space. Lower slip plastic syringe. Lower slip plastic syringe allows a needle to be pushed out onto the end of the tip if a needle is required. And then epidural catheter. It's a very thin and flexible catheter. And it's in your epidural space. Through it you will get medicine, which will stop nerves from sensing pain. Plastic lower syringe, a plastic syringe for injections having a simple screw lock mechanism that securely holds the needle in place. Flat epidural filter, an antibacterial and particulate filter. The bright yellow filter body helps the healthcare workers from knowing the difference between an epidural filter and an IV filter. The flat filter style also promotes patients' comfort, so it doesn't hurt them in the back. Filter straw, the filter reduces injections of contaminants. Reduction of contaminants lessens potential side effects, which are caused by infused particulates. Needle block foam. The foam reduces the accidental sticks from accidentally sticking the doctor, the anesthesiologist, or the nurse anesthetist, or the patient again. So they would put the needle in here for safety issues. Prep sponge, they're highly absorbent and can be scrubbed on the back prior to surgery. So before the surgery, they have 3 of these, and they would go in circles, and on the back they would clean the back with this prep solution, which disinfects wounds and protects against possible infections. And most anesthesiologists and CRNAs would put a clear drape that surrounds it. It acts like a barrier, a stereo barrier, maintaining a stereo barrier field during a surgical procedure. Pin pad, the pad enables optimal position of filter and has a attached epidural catheter connector. So this will go right here, so the wires don't move, they don't get tangled and stuff. sodium chloride injection, a sterile non-pyogenic solution for fluid that can be used for loss of resistance. So right here, whenever anesthesiologists are trying to find the epidural space, they would either use air or they would use sodium chloride. And it can be used to flush out the catheter. So if there's like medicine stuck in the catheter right here and it's not going through, they would put sodium chloride to flush it out. Lidocaine ACL with epinephrine. It's a test dose to make sure the catheter is in the correct space. So it's not in the subarachnoid where the spinal would be, and it's not in the blood vessels. It would cause a lot of harm if it was in the blood vessels in the back. Lidocaine HCl, it's a local anesthetic. It's used for decreasing discomfort and pain, and it causes temporary numbness, loss of feeling in the skin and mucous membranes. Conclusion. In summary, we have discussed spinal and epidural anesthesia and the risks or benefits associated with it. Spinal and epidural anesthesia can both have contradictory and benefit effect on a person's body. Spinal and epidural anesthesia can also cause many neuraxial anesthesia, which is very rare. All of anesthesia has risks. It is generally very safe. The risks and benefits are weighed for each patient prior to surgery, proceeding with an anesthetic plan so the safe patient care is delivered correctly. Why I enjoyed this study, why it's valuable to me, and what I have learned overall. I enjoyed this study because it's very interesting to me how different anesthetic drugs work on different patients differently. Being mentored by a CRNA is very valuable to me because I want to pursue my education into becoming a CRNA or an anesthesiologist in the future. I have learned the different anesthetic drugs that they use, the machines, equipment they use, and the things they as CRNAs have to write down and record every 5 minutes of the surgery. Thank you for attending my final presentation. Thank you, Christy, for assisting me this semester with many things I needed help with and answering all the questions I had. Thank you, my teacher, Christy Click, my evaluators, and my parents for coming to see my final presentation. Any questions? That's what.
Okay.
This is the epidural anesthesia video that we couldn't get on there. So he's cleaning the skin with prep solution. And then they don't have a drape, so they're sterile. They use sterile covers. And they're filling where the hip is, and then they usually do it above the hip. Injecting the local anesthetic to numb the back before injecting the epidural needle. Now they're going to insert the epidural needle. They're locating where the epidural space is by using air instead of sodium chloride. put the epidural catheter inside the epidural needle. And then these marks represent 1 centimeter, so it lets the anesthesiologist or nurse anesthetist know how deep they're going in. And after the catheter is in there, they can remove the needle. Now I think that's the lidocaine HCl epinephrine they have, and they're testing the dose. Test dose. And now they're just securing the catheter in the back. This is the Spinal Anesthesia video. Couldn't be played on the large screen. That's the prep solution. And that's the prep sponge. That's the drape. And those are those liquid anesthetics. Spinal needle. Right there, spinal needle. Which is very thin. It's thinner than the Toei needle. And that's another local anesthetic. Sterile gauze.